Circumcision, mostly so-called medical circumcision, is a very common practice in the United States, with most males being circumcised right after they're born. This is irrelevant of religious affiliation. Now, I know this is going to piss a lot of people off, but I have to put it out there. In my view, circumcision should be performed under two sets of circumstances. Religious, either you belong to the Jewish faith or Islam. The other case for circumcision should be to address specifically a medical issue that's ongoing, for which circumcision can actually offer a viable medical solution. I do not support the wide use of so-called medical circumcision. Here's why. Dr. Yuval Bibi, dermatologist, mission: break you out of the skincare and medical matrix of excess and get you the more nuanced approach to skincare and medical care. First of all, leaving costs aside, and circumcision does cost money to perform. Circumcision is a surgical procedure. It does come with risks, even when it is needed to address an actual medical need or as an article of faith. There are real-life risks, specifically infection, scarring, disfigurement, effects on sensitivity, and so on. So circumcision is not nothing, but rather a serious surgical procedure. As a physician weighing in on circumcision, my first directive is to do no harm. So if I were to recommend performing a procedure, let alone a surgical procedure, the benefits must outweigh the risks. So outside of circumcision for religious reasons, most males are circumcised for so-called medical reasons. The reasons often listed are preventing certain types of infections, specifically sexually transmitted infections such as HIV, herpes simplex virus, genital warts, as well as lowering the risk of penile cancer. If we look at the studies that claim that circumcision is associated with a decreased prevalence of sexually transmitted disease, well, it's a mess. First, there's a mix of various study designs that are folded in the mix. Some claim a significant reduction in prevalence of sexually transmitted disease such as HIV in high-risk population, though this is not consistent. Second, it is often overlooked that much of the data collected in these studies relied on individuals reporting their life choices in their engagements in life, which is by default a highly unreliable method of data collection. And then there's the undeniable fact that one individual is nothing like another individual, with countless factors affecting their trajectory through life, especially over a prolonged period of time, which those studies dealt with. And one's trajectory through life, culminating eventually in HIV, could be very different than another person's trajectory leading to infection or lack thereof. Then there's the determination of causality. Even if you were to show a lower rate of infection in your treatment group, you would still have to conclude and prove a direct relationship between the treatment or the factor you're measuring and the actual effect. Association does not equal causation. Then there are the numbers needed to treat. STIs are not an extremely common thing, even in high-risk populations. So according to some of those studies, the number of men or boys needed to be circumcised to prevent one case of HIV is hovering around 50. Now, this is in a high-risk population setting, meaning if you were to accept the fact that circumcision actually prevents HIV, which was never proven by any of these studies, you would have to accept the fact that you would need to circumcise 50 boys and men to prevent one case of HIV. And as a reminder, the majority of the US population is not a high-risk population for acquiring HIV. So circumcising large swaths of the population to prevent HIV would actually be a serious overkill, not to mention the fact that HIV is actually easily preventable by vetting your partners well, wearing a condom, and if you really messed up, pre-exposure prophylaxis or post-exposure prophylaxis, all of which are far easier to implement than circumcision, not to mention these are not surgical procedures with a permanent aftermath. Now let's take a look at other issues circumcision potentially addresses: balanitis, urinary tract infection, and penile cancer. Well, here's the thing. These are fairly rare conditions. Balanitis is probably the most common out of all of these conditions, and it is still fairly rare. But interestingly enough, the majority of cases of balanitis are actually easily manageable with good skin care adjustment and topical medications, so certainly do not require circumcision, certainly not on a broad population basis. Now, there are specific cases of balanitis that may require circumcision. Those are usually in the category of lichen sclerosus / balanitis neurotica obliterans. Those are in cases of severe stricture of the foreskin that may actually constrict around the head of the penis, leading to other issues besides the condition itself. In very rare cases of Zuhn's balanitis, unmanageable by medical care, one may benefit from circumcision. That again is not a guarantee that the condition will resolve, but in those very stubborn edge cases, you may opt for circumcision. I can tell you that as a dermatologist who's treated hundreds of cases of balanitis, I've never seen one case of balanitis that actually required circumcision. Not one. Urinary tract infection, well, those are very rare in men to begin with. And when they do occur, they're usually due to a specific issue, either an immunological issue or a structural issue, both of which must be addressed to lower the risk for UTI. If there is a specific issue that has to do with a tight foreskin that wraps around the head of the penis leading to a UTI, circumcision may be the right approach, or sometimes preputioplasty, which is a reduction in the tightness of the foreskin wrapping around the head of the penis, bypassing the high risk of full circumcision. In any case, under those circumstances, circumcision or loosening up of the foreskin may work. You have to weigh the risks versus the benefits with your treating physician, specifically with your urologist, and find out what's the best course of action for you. Penile cancer, once again, this is a very rare condition, but your best bet is screening, and more screening. Early on, penile cancer is mostly easily recognizable and can be caught early and treated effectively without needing to circumcise anybody. If the cancer affects the foreskin, then yes, circumcision may very well be part of the treatment. But as far as preventing penile cancer, again, there's no justification for mass circumcision. Going back to lichen sclerosus or balanitis erotica obliterans, sure, circumcision under the right set of circumstances may be a game changer. Again, there's no preventative measures here, but really recognizing the condition for what it is and taking effective measures to mitigate the severity of the condition and potential downstream effects of what the condition does to the foreskin and the head of the penis. Obviously, consult with your dermatologist or your urologist or both to decide on the best course of action. Once again, all the conditions I've discussed are real, they do happen, but for the most part, they are unusual conditions. STIs occur in high-risk populations. Circumcision may help in some cases, but I don't think it justifies mass circumcision as a healthcare strategy. And one's best bet of avoiding STIs, again, has to do with their behaviors in the real world rather than circumcision. Preventing or addressing other conditions, as I've listed, again, those are pretty rare conditions. And circumcision is often not the preferred method of treatment or even prevention for these conditions. So again, circumcision is certainly in the cards under certain circumstances, but should not be used broadly as a healthcare policy or strategy, especially considering all the downsides of circumcision, unless, of course, we're talking about circumcision as an article of faith. Let me know in the comment section, what is your position regarding medical circumcision? Also, don't forget to share, like, and subscribe for more no BS skincare and medical perspective. See you next time. God bless.